terms that get thrown around often is medical necessity. So now that we're in this big insurance era, insurance is a hot topic on what we're going to do as a culture and a society. One of the things we want to get into is medical necessity versus clinically appropriate care. And this is where the two things can be different but work together, but also work separate. So as we're going through treatment with patients, sometimes there's limitations based by insurance companies where they have guidelines where we have to see clinical change that seems appropriate, but at the same time may not be as fast as the insurance company wants to see. So we'll often see, and this works for mental health, musculoskeletal health, things like that, where we'll start to see where like the definition of medical necessity may not seem like it's in line with what patients are going to be receiving. A common example is if you're not seeing a 20% improvement over 2 to 3 weeks, and you're not meeting your goals within that time, it is no longer medically necessary for care. Or if you're seeing a plateau, one of the things that I will often talk about with my friend that's a therapist is there's this overlap with if somebody's dealing with chronic low back pain or chronic pain that's musculoskeletal in origin, they probably need some ongoing treatments. Same thing as if she was talking about somebody that's dealing with some mental health things, they may need some ongoing treatments, but once they reach this plateau, they probably need some ongoing and continued treatment. That is clinically appropriate, but the insurance company is going to express that's medically unnecessary. It doesn't meet the criteria for medical necessity. So this is where we have to get into this debate and also understanding with the doctor, patient, and clients that where they need to be at and why their insurance may not be covering anymore, but why it's still clinically appropriate for them to continue care. And this could be a multitude of things. Unfortunately, as times have gone down, this line between the two is becoming grayer and grayer. So we just need to keep this up and have good communication with the patients.